Join the conversation with the Morning Majlis, Pulse 95.
Good morning and welcome on to the Morning Majlis. We're talking about the new COVID-19 field hospital that has opened up in the Emirate of Sharjah, named the Mohammed bin Zayed Field Hospital. It is going to be managed by SEHA, and it is a 7,000 square meter hospital with over 204 beds. Now, to talk to us in greater detail about this, we're very delighted to be joined by Dr. Marwan Al Kaabi, who is the acting operations chief for SEHA. A very good morning to you, Dr. Marwan.
Good morning, Ahmed.
Dr. Marwan, let's start talking about what is a field hospital. What is the function of this hospital going to be?
A field hospital is usually built to support an already existing facility within the region, to support basically the other healthcare providers to decongest some of their cases, to basically deal with the pandemic for this instance. And this hospital is part of many other initiatives and field hospitals that the UAE has been taking since the beginning of the pandemic to do so, basically to ensure that we have the right resilience to save lives and to support the other healthcare providers to continue providing the services they should be doing for our community.
And Dr. Marwan, can you talk to us about the facilities within this field hospital?
It is. What's good about this field hospital is not just basic field hospital. It's really built to the highest standard and equipped with the best equipment in the world. And also the integration is done to be fully integrated with our electronic systems to basically have the ability to do telemedicine, which obviously would improve the quality of care we provide to our patients. It can care for ICU patients, around 48 ICU beds and 156 normal beds, acute beds. However, all of them can be converted into ICU beds, if you like, HDU, high dependency unit, or ICU if needed to be. Obviously, to support this function as well, the hospital has got the other functions like pharmacy, labs, radiology, and other non-clinical support services.
So what I'm understanding, Dr. Marwan, is that it's not only for COVID-19 patients?
It is for COVID-19 patients, and it supports the main hospitals within the region directly and indirectly. Directly by taking care of COVID patients, and indirectly by decongesting their hospitals from COVID patients so they can go back and providing non-COVID services to the community.
And what are the working or visiting hours for this hospital, and how will you keep the families informed, basically?
Working hours is obviously 24/7, and to stay connected and to ensure good communication between our patients and their families, we have a call center. And the function of this call center to ensure good communication is happening, good information is reaching to the families, and also connecting the family with the treating physician to ensure them and keep them informed and updated on the status of their loved ones.
And Dr. Marwan, so how are we going to be admitting the patients? How is there going to be recommended patients from the current hospitals based in the Emirate of Sharjah, or is there a separate assessment where SEHA will be involved in admitting the patients? How are they going to be admitted to this hospital?
There is a criteria for admission, and that takes into consideration the ability of the function of the scope of this hospital and the limitation factors as well. And as I mentioned initially, it's fully integrated within the healthcare sector in the region. So transferring to this hospital comes only from main hospitals within the region that can be Sharjah or any neighboring cities as per direction of Ministry of Health and Prevention. So we don't accept cases directly from the community. They need to be coming from the main hospitals within the region.
Where in Sharjah exactly is this field hospital located?
That's a good question. I'm not from Sharjah, but I think it's called Al-Zahia.
Yes.
It's not,
yes, Al-Zahia.
Yeah.
Yeah. Dr. Marwan, can you talk to us about the importance of field hospitals? So you talked about how it takes the load off other medical facilities, but can you talk to us more about what makes it different and more tailored to COVID-19 patients and their needs?
It's tailored. We took into consideration so many of the lessons learned since the beginning of the pandemic. Most of the clinical areas they have negative pressure to ensure that our staff are protected, to ensure that good care of our patients. Also, as I mentioned, telemedicine is the infrastructure for telemedicine is built within the hospital to provide good level of care, not necessarily from the physicians on ground, but obviously any healthcare providers or experts from around the country, they can support with that care as well.
And Dr. Marwan, this is incredible in terms of what we're offering, because looking at the images that have been circulating on the social media as well, it's a very well established hospital with excellent lighting and information boards as well. But talk to me about the greater plan. We are expecting total of 7 field hospitals across the country. What are the updates from them?
We've already opened the Ajman field hospitals and just opened the Sharjah field hospitals, and hopefully we'll be opening the 3rd field hospital in the Northern Emirates very soon, inshallah. Obviously, since the beginning of the pandemic, SEHA and other healthcare providers have been building field hospitals and clinics around the country, and most of them is basically to ensure good resilience and support the healthcare providers and save lives directly and indirectly, as I said, by taking care of COVID cases or taking the pressure off our other hospitals for them to be able to provide care to our community.
And lastly, have we started accepting patients? Is there a set number of figures that we might have received so far for how many patients have been admitted at the hospital, or where are we at the operation stage?
We have actually, since the day it was opened, we've been receiving patients. We're taking it slowly, ensuring that the procedures, protocols, and guidelines are fully implemented. The staff fully oriented on implementing them, and we've been receiving patients on a daily basis, and hopefully that would support other healthcare providers in the region as well.
Lastly, but what is the capacity of the hospital again?
It's a total of 204 beds. Okay. 48 of them are fully equipped with the ICU infrastructure and needed medical equipment.
And can you talk to us some more about the medical staff, the makeup of the medical staff, and the special training they've received to handle this unique field hospital setting?
We have around 71 physicians and more than 200 nurses and around almost 70 allied health. That includes pharmacists, radiologists, RTs, and so on. And also have a big group of admin staff supporting the function.
That's incredible. And look, I mean, there's never a last question, is there, when it talks about COVID-19? It's a very topical discussion. We'd like to use this as a platform for you to communicate with the general public who's listening in to us on Pulse 95 about the importance of following the precautions and the protocols that have been given to us by the government, and understand the gravity of COVID-19. What would you like to say to the public about the pandemic and severity of the pandemic, and the fact that it's not over yet? We're still receiving cases on a daily basis, but what should the public follow?
I would like to start with thanking them. Actually, we are blessed with the marvelous community that's been supporting all the healthcare, all the responders to this pandemic. We're also blessed with the great leadership that provides guidance and support to everyone, including the community members. So we would like for them to continue supporting us and continue being part of the community of the UAE. And this initiatives and commitment of our community has been helping saving lives since the beginning of the pandemic, and we would like to continue to do so. hopefully, inshallah, very soon, when it's over, we'll have all our loved ones with us and we'll go back to our normal lives together.
Well, thank you very much for your thoughts. And are there plans of having a vaccination center at this field hospital at some point in the future?
That's not the plan for the moment. However, we have many vaccination centers in all the UAE. That includes one in Sharjah. As most of our drive-through screening centers, they provide vaccination services as well.
Fantastic. Well, thank you very much for joining us this morning, Dr. Marwan. It's certainly a pleasure, and we wish the entire team at SEHA, firstly, we thank them for their efforts on the front line, and lastly, all the very best in the operations here in the Emirate of Sharjah.
Thank you very much.
Thank you, Dr. Marwan.
So you were listening to Dr. Marwan Al Kaabi, who is the acting operations chief for SEHA, who joined us very kindly here on the Morning Majlis to discuss all the operations of the authority here in the Emirate of Sharjah. Stay tuned to Pulse 95. We shall return right after the news headlines, in fact, so we let you enjoy some musical entertainment that the station has to offer. If you'd like to get involved, you can text us on 4215.
If you liked this episode of the Morning Majlis, drop a like and subscribe.
95.
Be sure to follow us on Instagram for all our daily updates and top stories.
Pulse.